Hi, I'm Bob Schrupp, physical therapist.
And I'm Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
I must admit, Brad, you've never looked better.
Thank you very much, Bob. Now, can we get on with the show?
Yes, let's get on with the show. Brad, quite often we've had people that come into the clinic and they're really concerned because they have a bump on the back of their leg.
Yep.
And
they should be, actually.
Yeah, it's interesting. It's amazing disproportionately how concerned they are. They'll be less concerned about extreme pain in their knee, but as soon as they get that bump, they're really worried.
Yeah.
So what we're talking about basically is generally, if we turn this guy around, we look at the back of the knee. You got that ball, Brad?
Yeah. I dropped it, Bob. Hold on.
Way to go, Brad.
Yeah.
Generally, it's a bump that's on the inside of the, more towards the inside of the knee, towards the other knee.
Right. So
Yeah, it's right here, and it's usually the size of maybe a marble. It's not this big, but it is soft like this ball.
Sure. Yeah.
Okay, and there's fluid in it.
Mm-hmm.
And people are they're thinking that actually is the problem when actually it's the secondary part of a problem. Really, is what has happened. So a little bump right there or right here.
Yeah. So if you're looking at the leg, right in this area.
So it'll be right here, right in that area.
Yep.
A bump. And what that is called is a Baker's cyst, and this is after William Morand Baker. He was a surgeon back in the 1800s, and he's the one that first described this. It's also called a popliteal cyst. Popliteal, Brad, by the way, means, you know how you got the armpit?
Yeah.
That's the knee pit, is the popliteal.
Yeah. So the popliteal fossa in your PT school.
Right. It's anyway. So what's causing this bump, Brad? You know what, Brad? We should probably have that knee model too.
Yeah. Could you toss it
Nate,
over
can
here?
you? We make Nate film. We make him toss. We make him do everything here. Generally, with a knee problem, or generally when there's swelling in the back of the knee, the problem is actually inside the joint itself.
Mm-hmm.
And so I don't know if you can see any of this.
Yeah,
Nate.
the model of the knee and the kneecap here has been flipped up.
Yeah, but generally there's the cartilage here, and that's torn, or you have arthritis in here. So this is causing inflammation here and fluid, and that fluid seeps out towards the back into that sac, and it's a one-way valve, so it can't come back in again.
Right.
So you get that fluid here, and it can't go back into the joint. Now, the treatments for this are, you can get a corticosteroid, they can shoot that in there, you can put ice, you can compress it, wrap it. What people often quite have done is they stick a needle in it and they aspirate it, they actually pull the fluid out of there. And they think, great, it feels better, but the problem is it'll probably redevelop again unless you get what's going on inside treated.
Get to the problem.
So the arthritis or the torn meniscus or the torn cartilage needs to be treated in order for that fluid not to keep being created. Right. So again, this really isn't the problem, this is just a symptom of the problem that developed. So that's basically what this video is about. I mean, that's all we're talking about today is we want to let you know it's not something to panic about. Now, occasionally, rarely, those can burst and they can even cause a blood clot to go into your leg, and so you do want to be worried. This is something you do want to have your doctor check out.
Right.
And
so yeah, if it is a blood clot, then you need to have some definite treatment.
Right.
All right.
And I don't think we got any other issues. Let's see. I think we covered everything, Brad. It's a one-way valve, and it doesn't want to come back again. So the fluid comes in, and it doesn't want to go out again.
Right. And so it's right there. Right there's the model. Yep. Okay.
And for you physical therapists, we have therapists that watch this, Brad.
Absolutely.
It's between the semimembranosus and the gastrocnemius muscles, and it's a bursa. It's actually I think it's the semimembranosus bursa or the gastrocnemius bursa. We have all those bursas back
People
there.
that just got out of school remember those a lot better than us. But one way or another, I don't know why they watch us, Bob.
Wow, that's a great tribute to us. All right, take care.